And facelift recovery is actually rather counterintuitively very, very straightforward. Most patients experience a little bit of pain afterwards, and a lot of our patients are concerned about pain after surgery. And actually, after facelift surgery, there's minimal amount of pain. Sometimes there can be some bruising, and that generally tends to be around the neck area, and that's because that's the most dependent area of the face. And if the patients have had a concurrent neck lift, they tend to get a bruising a little bit under their chin and neck. There may be a little bit of swelling, and generally that tends to subside if patients are managed to sleep upright in bed, and usually within about a week or so. In terms of stitches, I use absorbable sutures, so there's nothing to be removed, but we generally tend to see our patients around 1 week following surgery to make sure that there's no infection. At 2 weeks, pretty much all the patients' bruising have subsided. The swelling can take up to about 6 weeks to fully settle down, but at that point, then most patients at 2 weeks are back to normal life and back to work. Yes, there is a little bit of pain and a little bit of swelling after this form of surgery. We generally tend to use a local anesthetic mixture, which has some steroid in there that helps the swelling post-operatively. So swelling is not a main feature, and a lot of the issues about swelling is often because patients have not slept upright enough in bed. And so for any patients that develop swelling after the surgery, we generally tend to recommend sitting a bit more upright in bed, and that tends to settle the swelling down. With regards to the pain, this is actually very, very minimal. Again, I use a very long-acting local anesthetic in my mixture before the facelift procedure, and that generally tends to last about 12 hours following surgery. At that point, patients then can start simple analgesia with paracetamol and codeine, and that controls the pain. And pain really is not a major feature of this type of operation. So our advice after a facelift procedure is that for the first 24 hours, patients should take it very, very easy. They're allowed to mobilize, but nothing that would increase their blood pressure, i.e. no running or no form of exercise. We recommend that they sleep upright in bed as much as possible, and that will control the swelling and some of the pain. And then over the next few days, we ask our patients to mobilize as much as possible. It's usually around 2 weeks before they can go back to normal activities like driving and returning to work. And then around 6 weeks, they can do all forms of activities, and that includes strenuous exercise. This is a question that I'm often asked about, what can I do to speed things up? Recovery is really a combination of patient factors, which is, kind of inherent in terms of patients' pre-morbid state before they come into surgery, and also a lot to do with surgery itself in terms of the technique and the kind of local anesthetic and the post-operative management. Really, a lot of the post-operative recovery is down to us. We recommend patients to contact us if there's any concerns. And there's really not much that they need to do apart from making sure that they sleep upright, they avoid strenuous exercise. We also tend to recommend for patients not to take medications like ibuprofen, which can cause an increase the bruising after surgery. But apart from that, really, there's not a lot that patients need to do. We will look after them to ensure that actually their recovery is as smooth as possible.